How you doing, Jackie? My name is Darian. I'll be your student nurse today.
Hi, nice to meet you.
All right, I just have a couple questions. First, can we start off with an S-bar?
Sure. Our patient today is Mr. Ronald Jarvis. He's in room 622. His attending physician is Dr. Phillips. He's a 67-year-old male. He weighs 171 pounds. He's 5'11". He has no allergies. He's a full code status. He comes in today, his chief complaint, he has a non-healing wound on his right heel with high blood glucose readings. He has a 20-year history of being a type 1 diabetic. He reports of a new lesion on his right heel, which he first noticed 3 weeks ago. He states that it's not healing and has become increasingly painful. He tried soaking it in some salt water at home, but it did not provide him any relief. His current health history, he's complaining of increased blood glucose readings, his current health problem, for the past 5 days, with results of in the 300s was his glucose reading. He also has the non-healing wound on his right heel, which I told you. He was diagnosed about 20 years ago as a type 1 diabetic, and he has been insulin dependent ever since. Right now, his glucose ranges were running in the 120s up until 3 weeks ago when they started going very high. But his last hemoglobin A1C check was 3 months ago, and the results of that was like a 5.2%. Family history: his father died of a heart attack at the age of 53, and his mother died of lung cancer at 78. His background dietary history: he reports that he follows a 1,800 calorie diet. Up until recently, he said he hasn't been following it correctly. The patient also has an IV site on the right peripheral forearm. His activity right now is as tolerated because he's in pain. His vital signs are every 8 hours. And upon assessment, his vitals today were within normal limits. The only thing I noticed was some abnormal labs. His calcium was low at 7.4. Also upon assessment, the patient is alert and oriented ×4. He is pleasant to work with. His lung sounds were clear auscultations. His heart sounds, his S1 and S2 were heard. There was no murmur or gallops, and his abdomen is flat and symmetrical. There's active bowel sounds in all 4 quadrants, and he is able to void himself. His urine output today so far was 320 milliliters. Regarding his pressure ulcer on his right heel, we measured it, and it came out at 5.5 centimeters to 2.5 centimeters wide. It is about 3 centimeters deep at the wound base, and there is no tunneling or undermining, but there's some moderate serosanguinous exudate. So we'll be also taking a look at that today as well.
Okay.
Alright, and the other thing is we recommend right now that he gets some insulin for his high glucose reading. He's going to be receiving some regular short-acting and long-acting insulin.
Gotcha. So just a couple questions. Why specifically is he receiving this medication?
He's receiving this medication because when we checked his blood glucose level, it came in at 242. So there was a sliding scale, and the sliding scale was about 181 to 240, so he just passed it.
Okay. So what action does that have on the body, the medication?
The long and short-acting insulins have the same action, which is it lowers the blood glucose by stimulating the glucose uptake in the skeletal muscles and fat.
Okay. So when should you question administering this medication?
You should question it if he has any allergies to the medication, and also if his blood glucose readings are within normal limits, you want to withhold the medication.
Okay. So does this medication have a therapeutic serum level?
For this medication, no.
No. What vital signs must be monitored?
You want to monitor his blood pressure. Make sure he doesn't have high blood pressure because that's a sign. It could be a sign of tachycardia, which is a sign of
Which physiological parameters should be monitored when the medication is being administered?
The injection site, if he has an allergy, you'll notice upon giving the injection some red and irritation at the site. Also, if you give him too much insulin, he could turn hypoglycemic, so you want to monitor the amount of insulin you give.
Gotcha. What interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
You want to make sure that right after you give the injection that he eats some kind of snack or a meal. That's important, otherwise, you know, he can bottom out. You also want to make sure that he lets you know which site to administer the medication. You don't want to give it on the same site. That can cause, you know, lipohytrophy.
Okay. What interventions must be taught for taking the medication safely at home?
At home, since he's been a diabetic for 20 years, he knows pretty much how to administer his own insulin. But you just want to make sure, you want to reiterate that he knows how to do the injections, to rotate injection sites, to go ahead and wash it with soap and water beforehand, and that he knows how to store it properly.
Okay. What are any side effects or potential adverse reactions?
Some side effects are hypokalemia, lipodystrophy, hyperglycemia, and anaphylaxis reactions.
Okay. How will you know the medication is effective?
After giving the medication, we'll check back with him in about a half hour and take another glucose reading, and if it's gone down, then we know it's effective.
Gotcha. All right, no more questions.
Okay. Before we go in the room, I pulled the medications from the med room, and I just want to go over them with you. You can take a look here. I have the short-acting insulin, and I have the long-acting insulin. I want to check the expiration dates. Okay, and I want to make sure I have the proper dose. I have the right patient. Make sure he doesn't have any allergies. Make sure I note the right route, the right time, and the right administration.
All right.
We're going to go in the room now. Hi, good afternoon.
What's up?
How you doing, Mr. Jarvis? My name is Jackie. I'm going to be your nurse today. I have Darian with me today. He's my student nurse shadowing me.
How you doing?
I'm going to go ahead and wash my hands before we get started. All right. Can you verify your name and date of birth for me? Your name and age?
Ronald Jarvis, 67.
Okay. Do you have any allergies?
Nope.
Okay. Thank you. Okay. Mr. Jarvis, today we're going to be giving you 2 injections of insulin. One is a short-acting, which is going to be 12 units, and the other one is a long-acting, which will be 18 units. I see here that you've been also said that you've been following a 1,800 calorie restriction and a low sodium diet, but lately you kind of fell off track with that. Is there any reason why, or just any?
I started back eating pork.
Okay, well, we can definitely give you some education and some pointers after. I'd love to help you out with that. Okay, so if you want to come around here, we're going to get started. I'm going to verify my medications with the patient. Can I see your wristband one more time? Okay. Okay, so I want to make sure I have the right patient. I have the right time, and which is 2100 hours. I have the right dose. I have my long-acting and my short-acting, and it's going to be 12 units in the right injection site. Okay, let me go ahead. Alright, if you want to come around here and see, once it's, you'll see a red light, and then once the drug and the patient's ID is in there, it'll turn green, which it has. Okay. Alright, I'm going to wash my hands and we're going to get started. Put on some gloves. Okay, Mr. Jarvis, can you verify your name and date of birth for me one more time? Name and age?
Ronald Jarvis, 67.
Okay, and no allergies. Alright, so we're first going to be preparing the injections. So let me go ahead and open up the syringes. And this is a sub-Q syringe, subcutaneous. It's used for insulin injections. It's an insulin syringe. We're going to be giving it sub-Q. First, want to go ahead and wipe the vials for 15 seconds. Okay. So I'm going to be preparing both. I'm going to first start with the short-acting insulin. Okay, and I'm going to drop 12 units of air. Okay, and I'm going to be injecting the air into the short-acting insulin. And then I'm going to pull back and withdraw my 12 units. I'm going to withdraw just a little bit more to get the bubbles out.
How are you feeling?
Feeling good. How are you? You did really good. It didn't hurt at all.
Alright. Any more interviews?
Good bubbles.
Do you have any other questions?
Can you verify that this is 12 units?
It is.
Okay, I'm going to single-handedly recap.
Oh, here it is. That is low, and we're gonna have
Okay, here's the first one. Now we're going to do it again with our long-acting insulin.
Go ahead and let me know when you're finished with your dinner, and if you have any redness, itchiness, or
Track back 18 units of air.
on your injection site, which is in your tummy on the right upper side.
And then I'm going to insert that in our long-acting insulin, the air. And then I'm going to take out 18 units. Same exact method we did. It's the first one.
Alright, so I'm just gonna go ahead and document.
Right, can you verify that there's 18 units in there?
There.
We're going to recap. Single-handed. Okay, so I have the 18 units in my right and the short-acting on my left. All right, Mr. Jarvis, since I have 2 injections for you, where was your last injection site?
My belly.
Okay, I'm probably going to do one on your right and one on your left. Was the one on your right done earlier in your upper or lower?
Upper.
Okay, I'll make sure to do that one on your lower. So I'm first going to wipe the area. Let it dry. Okay. I'm going to go ahead and give him his insulin, short acting. This will be on the right lower quadrant in a 90-degree angle. Alright, so I'm going to go ahead and put this in my sharps container. And then I'm going to go ahead and administer the long-acting insulin. This will be on his left quadrant. Alright, at a 90-degree angle. And we hold it for 5 seconds. Alright, I'm going to dispose of this in the sharps container. Take off my gloves. I'm going to go ahead and, you're fine. I'm going to go ahead and throw away my trash. Wash my hands. And then we're going to document that we gave him the short-acting 12 units and the long-acting 16 units. And where it was given in his right lower abdominal quadrant and his left abdominal quadrant. And the time. All right. Are you in any pain right now?
Nope.
Okay. Lastly, I want to go ahead and ask you about the education of the diet. I have a video that you can watch. It's very informational regarding the diet, things like that. Also, I have a pamphlet for you. Also, I want to make sure that you're aware of the side effects. Two of the main side effects was the lipodystrophy and the hypokalemia. Can you repeat back two of the side effects for me? We're just using the teach back method.
Hypokalemia and lipotrypsy.
That was a good try, but you got it. All right. So we're gonna go ahead and I see that you've had ordered an evening snack, so that should be on its way soon. Let me go ahead and lower the bell. Give you your call light. Lower the bed. Make sure the safety alarm is on. Can I get you anything for right now? All right. I'll be checking up on you in a little bit.
All right.
Alright. Were there any pertinent pieces of information you reviewed before administering the client medication?
Yes, the main things I reviewed was if he had any allergies and also his glucose readings before administering the medication, as well as his blood pressure.
Okay. Does any of that information affect your decision to administer the medication?
Yes, if he had the high blood pressure, we definitely want to notify the physician of any changes like that. If he had any allergies or his blood glucose was within normal range, we wouldn't have given the medication.
Okay. Did any of this information affect how you administered the medication?
Yes, it affected the way that how much insulin I was to administer based on his glucose reading. It let me know his sliding scale and how much insulin to give.
Okay. Alright, thank you.
You're welcome.